presented with all the counties what they have verified. Maybe you can tell this committee how much was verified for your counties, and they indicated that the facilities which are owed less than 10 million, they are in the process of paying. And I'm looking at a letter written to you on 7th March 2025 from COG, where listing the NHIF money which is owed. And for Siaya County, I'm only seeing Siaya County Referral Hospital, the document you've attached. Maybe the other hospitals, the other facilities within Siaya, they don't have paid increase for NHIF.
Your permission, can I defer to the CEO?
Through the chair, we have all the facilities that were benefiting from the NHIF scheme have pending claims that have not been honored by SHA. Pending claims from NHIF.
Senator, use the mic.
What you've attached, you are only showing Siaya referral. You are not showing the other facilities, your own documents.
My apologies, sir. That I think we attached that in respect to the document we were presenting for Siaya County Referral Hospital.
Any other issue, auditor? Further comment?
Chair, I think the rest of the observations you can in your wisdom you can consider the responses submitted.
So just honorable members, we agreed that we will invite the CS for health to appear before us, because this delays in reimbursement of SHA have the potential to bring down our hospitals. They have a serious potential. I would like to get a comment from the county assembly on this particular issue.
Thank you, Chair. I think we have the same recommendation that we have also advised, because previously the facilities didn't have the accountant, but we have also advised them that they should be having qualified people. Also, we have also advised that the med soup should not be the accounting officers, because sometimes they're busy in the theater. They need to have the administrators to do this, so the smooth running of the facility can be seen.
I think you brought up a very important issue of having accountants in these hospitals, because there's huge amount of money there, and I think the auditor has raised some issues around there, which auditor, you said you will look at the reconciliation in the next financial year. Is that the case?
Yes, Chair.
So any more comment on that? Okay, we can proceed to long outstanding payables, and our base is going to be Bondo level 4 hospital.
Thank you, Chair. Report trade payables for Bondo Level 4 Hospital. The statement of financial position, and as disclosed in note 36 to the financial statements, reflects trade and other payables of Kenya shillings 8,789,903. Analysis of trade payables ledger provided for audit revealed that the hospital owed KEMSA Kenya shillings 2,240,000.
Which one are you reading?
Bondo Level 4 Hospital, paragraph 4 of the report.
Sorry, I was looking at Ambira. Can you give me the, just proceed.
However, documentation supporting the debt owed to KEMSA and the aging analysis were not provided for audit review. In the circumstances, the accuracy and completeness of the balance of Kenyan shillings 8,789,903.4 in respect of trade and other payables could not be confirmed.
Governor, your response?
I ask the CC for help to respond.
Thank you, Chair and Committee. The management response, I read, we note your observation and wish to state that the supporting documents to show debt owed to KEMSA totaling Kenya shillings 2,214,511 are now available for your verification. The payables aging analysis report is also available for your review. There are annexes, the Annex 3, payables, aging analysis report, and invoice, delivery notes owed to KEMSA attached.
Auditor, your comments on the response?
So the aging analysis has been provided, the invoices have been provided, so the issue is addressed.
But at what point was it provided? Why was it not provided during the audit?
Yes, Chair, that is the matter for concern because these were provided during the responses to the Auditor General's report.
Senator Eddie Okech, Vice Chair, introduce yourself.
Thank you, Chair. And I think now is afternoon. Good afternoon to you and the committee. And good afternoon to Governor, together with your team. My name is Eddie Okech, member of this committee and the Vice Chair of this committee. And not sure whether Linda Ground or Linda Mwananchi has got membership, but maybe you'll advise after this, so that now that membership is membership, we can be able to see. But I welcome you.
I can assure you we are on serious business now. But you can ask that question outside. Okay. So any question?
Looks like he is on the way.
Any question, Senator Mbugua?
Yes, Chair. On the payables for Siaya, there is a payment plan, Governor, which you annexed, Annex 5. Maybe you can tell us, because it was ending in 2025, but maybe you can tell us whether you are able to do the payments as you had planned in this payment plan. Annex 5 of Siaya Referral Hospital.
The CEO has an answer to this.
Chief Officer.
Thank you, Chair. The payment plan for Siaya County Referral Hospital that was ending in 2025 was honored. But I wish to add that indeed we still have quite a bit of pending bills running across the various facilities, and this, Chair, ties to the previous question about what we are owed by both SHA and NHIF. Totally, our level 4 hospitals have outstanding pending bills of about 127 million across the 10 hospitals.
Chair, on the same query, the auditor noted that there was no explanation given for the increase in the payables within that period. So if you honored, then why was this increase noted by the auditor of, I think, is it from 21 to 36 million within the same period?
Through the chair, as the facility collects money and receives money, the reimbursements, we try to do the first in, first out. So then the facility still incurs costs as we offer services. That is why the amount would still appear to be increasing, even though we sought the long-standing payables.
So maybe you need to tell us what are you doing about these KEMSA payable? Is it affecting your supply chain?
Chair, we treat KEMSA as our preferred supplier in Siaya County. We try to address whatever pending bills that we have, so that the debt does not go beyond 120 days, and that is how we remain in their good books. So we pay what we owe them, but we still order once we are in the green with them. We still order more commodities from KEMSA.
Maybe you also need to give us the payable situation for the other hospitals.
Chair, I can go individually for the other facilities, but I did mention, sir, that across our 10 level 4 hospitals, we currently have an outstanding pending bills of 127 million, sir.
For all the hospitals?
For all the level 4 hospitals in Siaya County, sir.
So what are you doing about them?
Sir, on our part, we do the aging analysis, so that as we receive funds, we try to address the oldest. But as our governor did mention, and the request that he put to the committee, if at all SHA can settle what we are owed as a county, then indeed, if you compare the total figure, what we are owed 261 versus what we owe, which is 127, we would as a county be able to offset all that we are owing our vendors and suppliers.
Okay. Any more question, comment?
Chair.
Yes, proceed.
Chair, for me, I think when the county is owed, I feel age. But when county owes somebody, and that person is not perhaps very keen on getting their money, I feel okay. But that said, I would want to understand whether this payable to KEMSA has hindered any services in terms of getting medical supplies to the hospital in any way.
Through the chair, while KEMSA is the preferred supplier, there are times when certain facilities are not able to pay within the 120 days. So then they are not able to make an order to KEMSA. In such a case, then for the commodities which are needed, they would go to other pre-qualified vendors, including meds and others that have been pre-qualified by the county supply chain management. But we still insist and impress upon all our facilities that payment to KEMSA and being able to be on the good books of KEMSA is a priority right from the county level.
Chair, that's a very clever answer. Just hold everything constant. Tell us paribus. If you hold anything constant, no any prevailing circumstances, has there been hindrance of service just because KEMSA is looking for this money? You're giving me a conditional analysis that should there be problems aside of KEMSA and whatever, you can look for other vendors. No, I'm just talking about just as a result of this pay. Have you have any confrontation with KEMSA?
No, we have not had a confrontation with KEMSA, and services have not been hindered. But from management point, anytime when we are not able to, when a facility like Bondo is not able to get commodities from KEMSA and they get it from another vendor, then they may get it at 1 shilling more. So from management point, that is a problem.
Yeah, Governor, this chief officer understands his role very well. From the way he's answering.
I'm lucky that in this department, they're all doctors, including the CC member, Dr. Konyango, who has worked with the UN and been at some, posts worldwide. I just didn't see him salute the chairman today when he entered.
Thank you. Any other comment on that? Okay, honorable members, we proceed to the query on UHC, and we'll go for the big hospital in the county, the Siaya referral. Auditor, you can take us through deficiency in implementation of universal health coverage.
Thank you, Chair. Deficiencies in implementation of universal health coverage, UHC, Siaya County Referral Hospital. Lawman number 1 is a service delivery gap. Review of hospital records and interviews with management revealed that the hospital has 14 medical officers against the required 16. 0 and is the serologist and radiologist against the two for each category, and 1 pediatrics against the required 2 as tabulated below. So there is a table there, staff requirements, the 4 standard number in hospital, and the variance and the percentage. So for medical officers, there is a variance of 2, and the serologist variance of 2, pediatrics variance of 1, and radiologist variance of 2. In the circumstances, the hospital may not be able to discharge its mandate as a level 4 hospital, which hinder the realization of universal health care objectives. These deficiencies contravene the first schedule of the Health Act 2017 and imply that accessing the highest attainable standard of health, which includes the right to health care services, including reproductive health care, as required by Article 43(1) of the Constitution of Kenya 2010, may not be achieved.
Very well. Governor, your response?
Can I ask the CC to
CC.
Thank you, Chair. Management response. Deficiencies in implementation of universal health coverage, UHC, service delivery gap. Management acknowledges the audit observation regarding staffing gaps affecting the hospital's ability to fully meet the service delivery requirements of a level 4 health facility as stipulated under the first schedule of the Health Act 2017. A. Context and contributing factors. Management notes that staffing levels are influenced by a combination of systemic, physical, and labor market dynamics, including attrition through transfers, resignations, and study leaves. B. Impact on service delivery, UHC objectives and mitigation measures. We acknowledge that the staffing gaps pose potential risks to optimal service delivery and the full realization of universal health coverage objectives, but have put in place interim service continuity measures to mitigate the impact, including 1, italic, task sharing and optimized deployment of available clinical staff, notably among anesthesia staff. 2 italic, referral of specialized cases to higher level facilities where necessary. 3 italic, engagement of visiting specialists and part-time consultants where skills transfers and specialist interventions occur, e.g. the surgical in-reach camp. 4 italic, telemedicine, for example, through remote CT scans reporting, facial surgeon, ENT surgeon, dermatologist, audiologists, renal and cardiology clinicians. These are represented by Annex 7, which is the extract of surgical camp program guide, CT scan reporting agreement, HPOD brochure.
Auditor, your comments on the response?
Yeah, the management has not yet fully complied with the health policy guidelines, and we have commented on their prioritization on recruitment or secondment of the specialists. They ensure infrastructure documentation of land as required by Kenya Quality Medical Health standards, and develop and implement a UHC readiness plan aligning it to Kenya Quality Medical Health standards, and also establish a monitoring mechanism to ensure continuous compliance with the standards. Thank you, Chair.
If you may allow me to add, we have got an ongoing recruitment exercise where we are trying to recruit more than 100 medical personnel. The interviews are ongoing, and I think at the end of that exercise, most of these deficiencies, as exhibited in the table on page 20, will be fully addressed. But that is work in progress. It does not take away the very legitimate concerns of the auditor.
Auditor, in your query, you seem to have only mentioned expert medical personnel, the doctors, medical officers. Does it imply that we have sufficient nurses in this hospital? Because you didn't mention anything about the nursing staff.
Chair, the report as it is, the way that bit is not there, but for nursing, Kenya registered nursing, I think I need to refer back.
To make full disclosure, we have indeed shortfalls, nurses, clinicians, and as I have said earlier, those are being addressed in the current recruitment exercise, which will be complete within a fortnight.
Senator Ogwa.
Thank you, Chair. You know, Chair, many governors have appeared here, and they have been telling us they cannot get these professionals. And we know Siaya is a supplier of these professionals, so the governor cannot escape because they are readily available, because most of them come from there. But Chair, I think even we should have gone to this hospital called Gogolo, because if you look at the table, Chair, the percentage of the staff which are supposed to be required who are there, who are working, is 89%. If you look at the services which are being offered, there is no surgical services, no pediatrics, radiology, renal services. Actually, Governor, this makes us wonder, is this hospital really operational, looking at this table from the auditor? Maybe, Chair, you can go to page 14 of Gogolo. The deficiencies, they are glaring. Page 14 of Gogolo.
Say page 14.
Starting from page 13, Gogolo.
So maybe in light of what the governor said, the recruitment is ongoing. Maybe the governor, you can tell us, in that recruitment, are you going to prioritize this hospital? Because the auditor has given variances.
Yeah, indeed that's the case. One, this hospital is a center of focus because of its situation, its geographical situation. It is at a point where people requiring these services find themselves in a very difficult position with transport and the like. So in the current recruitment drive, we are targeting Gogolo Hospital as a major area of interest, and I think within 2 weeks or 3 weeks we can report back and to this committee to demonstrate that we have not fully but substantially dealt with these variances. But I quite agree that we don't have fully the people that we require. But when you look at in terms of brick and mortar equipment and theaters, I think we have them in place. What do we need other personnel?
Auditor, you didn't give us a picture of equipment and machines at referral hospital. Does it mean that you were satisfied with those equipment, that they met the standard? Because in the query, you did not make a reference to equipments and machines.
Chair, the governor has just said, in terms of equipments, machines, they are fairly okay. And I can see on the same page that Senator Mbugo was referring to, page 14 of Gogolo. The incubators for newborns is 0. So if there was such a need, and I believe such arises, the hospital has no incubator.
Auditor, please.
Chair, we look at the issue in the subsequent financial year.
So you are saying it was an oversight on your side?
Not, Chair, because the report as it is, the observation is not there, meaning the issue could have been addressed during the audit.
Maybe I can come to maybe Governor, you can make a comment on what Senator Tobiko has raised.
I think essentially what the auditor is saying is correct. But if you look at the interventions which are ongoing, if the auditor comes to on site in another 6 months, the situation will be very, very different from what you are reading from your table. So I ask the committee that we can give a situational report on the situation at Gogolo. It's a fairly new but very far-flung institutions in the county. But in another 6 months, I think we'll be in a good place.
So I think we are going to, just like other counties, we'll make an inspection visit to Siaya, and we will look at some of these issues that auditors raised. Any other query or comment, honorable members? Control of budget. I can see you are raising your hand.
Yes, Chair. I don't know if the committee is still looking at the hospitals or you have closed. I wanted to bring...
No, we are still looking
okay.
at the hospitals. So I think one other issue that I wanted to comment on, which I've seen the county has actually resolved. The last meeting we had the issue of boards, the hospital boards, and the auditor, you have reported that the matters were resolved. Yeah, so maybe I would want the governor to comment on that. The hospital boards.
I think we have now had reports of all these hospitals. They have been trained, they have been gazetted. So I think we are in a different situation compared to the last time. And normally these boards have to get approval of the county assembly. And I can confirm the county assembly gave approval to the boards that we have established in all those hospitals.
Very well. So I think
Maybe Chair.
Yes.
Just a comment. Abila sub-county level for hospital is only hospitals now which have not established a board of management. Maybe the management can comment on it. Failure to establish a board of management. Abila sub-county.
So maybe, Governor, you can comment.
We have a board.
You have a board.
Gazetted.
So maybe you can supply the gazette notice to the auditor so that he can clear that way.
That's a place where I went to school, so
Yeah.
I know the visits.
County Assembly, do you have any comments on the hospitals?
I think much we have discussed on the same, and at the hospital they are really now improving on, because our recommendations go the same. We go to the hospitals, we see how they are improving. Like the boards we're talking about, we have done them already. I think everything is in place. We are trying to make them improve.
Okay, I think there is an improvement again, just like water. There is an improvement, but we will be on site after April to come and see for ourselves. So, honorable members, I think that closes the review. Proceed.
Thank you, Chair. I wanted to bring to the attention of the committee the issue of implementation of FIF. If we look at Siaya Hospital, there is a query on non-compliance with FIF. And this is an area which the Control of Budget is also interested, because we report on, like in this financial year, they did not meet the target. They were at 70%. Maybe non-compliance with the FIF Act is what is causing them not to achieve the target. And the committee is in a good place to advise on the implementation, considering their act is in conflict with the FIF Act, where they are sharing revenue, and yet Section 5 of the FIF says that there should be full retention of what is collected in the hospitals. That's what I wanted to mention.
But you remember that issue came up with the Kilifi and I think another county where they have an arrangement. I think even Moranga, we have a county legislation and we have the national legislation. And I think we directed that the legal officer, you give us an opinion on that. So maybe before I allow members to come in, legal officer, you can comment on that.
Chair, just want to give you an update, and then maybe legal officer can
proceed.
I've chaired I think 3 meetings this week.
Yes.
Where we had the same issue. The misnomer comes from section 7 of the FIF. Because section 7 looks at the functional allocation of the resources that are retained there. So I think that is where most counties were exploiting to perhaps defy section 5 that the COB is talking about. So Chair, I think that the rule of the thumb should be, we need to be stringent on section 5. Once we're stringent on section 5, any law that then violates section 5 then becomes inferior to FIF. Because otherwise, if you pick piecemeal elements of section 7, that, oh, this one we want to go and do with it administration here and there. We had a case for, I think it was Samburu, that was being very cagey with some programs that they want to do. Then it becomes defeatist, because then you will just have people like getting 2%, then it will be 3% to do another function in the departmental area, in the ministry, in the ministerial side of things, that then eventually you just claw back in the entire act of the entire FIF. So I don't know, but I think that we should not allow the exploitation of section 7, because there is a bit of section 7 that could talk about some functional elements that then goes to the departmental area. My recommendation as I finished here was this: if those elements of section 7, I think the legal will read them, can be implemented within the hospital, then I think it's fine. So if there's some administrative element or community engagement elements which you will read that need to be implemented, why can't you just retain the money in the facility and conduct that function in the facility, rather than taking a portion to go and do that function in the ministerial level? Chair, I yield.
Let me hear from our legal, and then I will come to the moving constitution.
Yeah, Chair, that sounds like there's some bias. I think it could be a Linda Mwananchi bias, principles among themselves, but it's okay.
Proceed, legal officer.
Thank you, Chair. Through you, Chair, when you look at FIF, that is Section 4 on the application of FIF, it applies from level 1 to level 5 of all public health facilities. And then when you look at our constitution, that is Article 191 of the Conflict of Laws, whereby under sub-article 2, the national legislation prevails over county legislation, where the national legislation applies uniformly throughout Kenya, and any of the conditions that are specified in clause 3 are specified, and that the national legislation is aimed at preventing unreasonable action by a county that is prejudicial to the economic health or security interest of Kenya or another county, or impedes the implementation of the national economic policy. And then through you, Chair, as the Vice Chair has already said, this act applies uniformly throughout the country. So ideally, it tackles the issues of health across the country. So it applies from level 1 to level 5 of all the public health facilities. And then there is the issue of retention of all the monies raised by public health facilities, and that is under section 5 of FIF. Under subsection 2, it states that there shall be opened a facility improvement financing account for each public health facility, into which shall be paid all monies received by or on behalf of the respective public health facility. And then, Chair, the issue of the uses of the finances that are retained by the public health facilities is handled under section 7 of the same act, whereby the finances that are retained by the public health facilities are used to A, support the respective public health facilities' optimal operations for effective service delivery throughout the financial year. B, subject to applicable financial laws and regulations, ensure readily available financial resources for the purchase and acquisition of urgent goods and services at the respective health facility. C, enhance where applicable the accessibility and predictability of finances for procurement of essential products, commodities and technologies. Ensure that health services are available, accessible, acceptable, affordable, and of good quality and standard. E, guarantee that health facilities are optimally resourced to offer quality care to all patients. F, facilitate primary health care and preventive services at the community level. G, sustain daily operations and promote improved access to health services to all residents in the Republic of Kenya. And H, to fund ambulance services for the transfer of patients from one health facility to another. So ideally, Chair, from the reading of the act, it would mean that all the money that is received or from a public health facility should go back to that health facility, Chair.
Very well. Maybe I'll get a comment from Governor on that.
I think the matter is not as easy as what has just been said and what I've heard. I think as a matter of interpretation of the law, there are several principles that must be applied, including that the basic structures of government as underpinned in the Constitution should never, through an ordinary legislation, which is the act that you're referring to, should not be weakened. Those structures should never be weakened. But the more important, and I'm not saying what I'm saying is the correct interpretation, but this is a fairly elaborate provisions of law, and it says the national legislation prevails over county legislation if. Now, there are a lot of parameters to look at for that legislation to prevail. And I want to say that I'm not convinced that if you look at the if, which is provided in Article 199, sub-Article 2, running to B, and then looking at the sub-Article 3, the conditions, which are the conditions referred in Clause 2A, and in its entirety, if you look at it, I think the situation is more complicated than it looks. I think a proper reading and interpretation and looking at the structure of the Constitution, any legislation that tends to take away the architecture of the Constitution as establishing national government and national institutions. The county government and institutions. Otherwise, this kind of legislation, I must say, the backdoor processes in which national government is clawing back on devolution. How counties organize themselves, what money is to retain, should be left upon on their judgment as enacted by the county assemblies. Otherwise, I think there will be a threat to county governments. I think we can also, think on the other side of the coin that there should be county legislation which prevail on national legislation, if that legislation has the effect of taking away the constitutional role of the county governments. So I am not arguing either way, but I'm saying it's a very complicated part of the Constitution, the conflict. My brother knows there that the conflict of laws is a very complicated subject in either international law or domestic law. There cannot be any easy answers. And looking at this section, I think it is important that we have a fully a proper interpretation, and maybe this is something which probably we should seek advice with the Attorney General on the part of national government, and we as counties can look for our lawyers here who can have a different interpretation. So I think we should seek a more elaborate interpretation. And now the thing, I would, if I was confronted with this subject as a major issue, I would have given up a more thorough and, opinion on this. But the danger is looking at, what has happened in the last 15 years. The danger is that the national government is, by legislation, which includes the creation of authorities like KENHA and KURA, they have invaded responsibilities of county government. So simply because there's that national legislation does not mean that that's the correct position. I think we should look at the Constitution and the rules that are set out in the Constitution as assigned to counties as opposed to national government. So before we can say our national county assembly is full, I think we need a more thorough determination of this subject.
I don't want to make it like a debate because I think we had earlier on directed the legal officer to engage the legal department to give us a legal opinion. Then a committee, based on that legal opinion, they can know the next steps they are going to take.
Chair, I get that, but I think that laws are not made in vain. I don't think laws are made in vain, because I think FIF has come at the backdrop of a number of interactions with county hospitals that were not able to function because of cash flow issues. And that cash flow was not necessarily the lack of resourcing by county government in the budgetary instrument of the county government, but it was because of the complexities that hospitals needed to go through back and forth. For instance, resources had to come from these facilities, sometimes go back to CRF, get an allocation matrix. Yesterday I was dealing with an issue here of serious resourcing for SHA, for, I think it was still Samburu, for those who were here yesterday, and just a misnomer of 9 million moving back to Samburu CRF last year. For them to get back that money, there has to be an instrument of budgeting in the next financial year, or where there is a supplementary budget to it. And then you find that all the functions that hospital was supposed to do within that entire year cannot happen because of that architecture of the law. So, Governor, I think that they also need to be good with, even by COG, that overall, if 80% of a law is good and is serving the purpose of being able to enhance the cash flow element of hospitals, I think you should support it. Because otherwise then we defeat the element of service provision, because that is the end game of any law. And Governor, I remember when you appeared here last year, we talked about even the municipalities. The question was, is our municipalities a government on their own? And we established that the spirit of the law was not to make them a government. The spirit of the law was to make them an agency to you as a government to be able to deliver service. And that's why that autonomy that was being given to municipalities would then do exactly that, enhance one service, and where there is more revenue generation than was anticipated by the county government, then the agency status comes in to propagate the idea of getting more revenue for your own source revenue from the same municipality. So while there could be technical argument around which law versus which law is superior, I think the core of the issue here is the need for that law. What necessarily the coming of that law, what problem are we trying to resolve? And that problem, I think that what we have seen in a number of counties that have implemented FIF, the truth is that they are actually becoming more functional in terms of service delivery in hospitals, and more importantly, some have even moved from just idea of service delivery to increasing revenue in those hospitals that are at the benefit of the county. A good case in example is Kisi. We have seen like a serious increase of revenue and a serious increase of service. So while we're still solving that misnomer of which is superior, Governor, I'm not a lawyer, but from a business perspective and economics perspective, I can argue the case for service delivery for our people, which is what this act sought to enhance. Just a feedback on that, Chair.
Just allow me just to say this. There's this general assumption that national law prevails upon county legislation. Yet the Constitution contemplates circumstances where county legislation prevails upon national legislation. And that is clearly stated in the Constitution, that in 191(3)(4), it states county legislation prevails over national legislation if neither of the circumstances contemplated in clause 2 apply. And then 5, in considering an apparent conflict between between legislation of different levels of government, a court shall prefer a reasonable interpretation of the legislation that avoids a conflict to an alternative interpretation that results in conflict. Then 6, a decision by a court that a provision of legislation of one level of government prevails over a provision of legislation of another level of government does not invalidate the other provision. So what we're saying, even if the court determines that the national legislation prevails, but it still does not invalidate, the legislation, the county assembly legislation. So as a matter of law, it is not an easy case to deal with. You've got to read this law in a wholesome manner. But I can understand why you are looking for a purposive
interpretation of the law. You know where you want to get to.
You know, Chair.
But I think it's a little more complicated than.
Okay, as Elia said, I'm not also a lawyer. I'm a computer scientist. But you know, this particular FIF Act, the money actually is retained at the facility to enhance services. There is nothing that comes to national government. So it is basically a law that has been done by a national government, but it's entirely being implemented at the county level. So it's not, they are not going back. It's only that maybe, as a lawyer, as you've said, maybe you need to seek some interpretation from Attorney General, or you can go to court.
So, but you see the county.
The other side of it from the county legislation is if you have a facility, a rural facility, for example, a dispensary that does not have any income, it does not get SHI, it does not get NHIF, how does it operate? So the county legislation was, good in the sense that it was saying, you got to look for, some income or financial input for the dispensaries and the health centers, as opposed to the hospitals.
Yeah, the governor is right, could be right, because maybe a particular sub-county, the clients to that particular sub-county, they are dispensaries and health centers that, they refer patients to the sub-county. So this particular sub-county hospital that is having FIF then needs to support. Yeah, that's how maybe.
Actually, that is the essence of the revenue sharing for all the counties.
Yes.
That the share, the 10% or 20%, goes to support those low-level hospitals. And I think there is sense there. That's why we directed, just for us to know the way forward, our legal division to come up with a proper opinion. Then this committee can see how to intervene. We can either amend the law or make some steps towards addressing the problem.
Through you, Chair, with your kind permission, there is also that under that section 5 of that FIF, under subsection 4, there is the issue of where the income and other receivables that are retained by the public health facilities are considered as supplement to the budget and resources appropriated to the public health facilities by the respective county government and not a substitute. And then when you look at the section 6 on the sources of the public health facilities improvement financing, it talks about what is retained, that is under subsection A, and then there is also paragraph B rather, on the money that is appropriated by the county government to the health facilities from the equitable share. So maybe we can get the views from the senior council on the same, because it seems like under the FIF there is the issue of the budgets that now the counties have to give to those public health facilities apart from their own source revenue. Thank you, Chair.
Yeah, I think we'll be labeling this for long. We need to move forward. I think the governor has a point, because a number of governors have appeared here and have complained about, for instance, this is a level 5 hospital, which probably could be the primary revenue catcher among all the hospitals. This could be the biggest in Siaya, which is understandable. So I get it when the governor says that there's a possibility that you needed some even 10% or 20% to be devolved or decentralized from this particular hospital to go and do some primary health care issues in the ground. I think that's a valid conversation. The only thing is that it is still difficult with the law, but the laws, it is us who make the law. So as you implement this law, and maybe this was not foreseen when we were making this law by the Council of Governors, these are crucial feedback that can form a basis for amendments, and it should be forwarded so that it is smoothened and allowed to to make it easier for governors to actually get some resources directly from some of these most performing institutions. I think it's pretty straightforward.
Okay, so I think the direction on legal opinion still stands. Legal department will give us an opinion, but for now, control of budget, I think you have listened to the conversation on that matter, and the auditor also. I know you sometimes strictly follow what the law says, but you can see the challenge that we are having. So meanwhile, we'll wait for the opinion to come and then we'll make a decision. So that brings us to the end of hospitals. We now have 2 funds. It is already 1 o'clock. So I hope we are going to end by 1:30. So we can have the officers of funds coming in. Governor, you can assist us in identifying the officers who have come in for the purpose of...
Thank you, Chair. Beginning with the CC in charge of education. Can you introduce yourself?
Thank you, Chair and committee members. I'm Dr. Edgar Otumba, CEC member in charge of education, youth affairs, gender, and social services at the County Government of Siaya.
Thank you, Chair, honorable members. I'm Richard Ogeda, Chief Officer in charge of education and training at the Government of Siaya. Thank you.
I'm Christine Odhiambo, Administrative Officer, Department of Education.
Thank you, Chair. My name is Zilpa Menya, Director, Executive Affairs.
Thank you, Chair. I'm Irene Owiti, the Accountant, Department of Education, Gender and Social Services.
I'm Opio Stephen, Director, Education and Training.
So I think we'll go straight on to the auditor. You can make a brief report on the 2 audit reports, and then I will give direction.
Thank you, Chair. The report of the Auditor General on Siaya County Bursary Fund for the year ended 30th June 2025. Report on the financial statements, a qualified opinion. And the report of the Auditor General on Siaya County Climate Change Fund for the year ended 30th June 2025. Report on the financial statement is qualified opinion. My comments on Bursary, Siaya County Bursary Fund. The major issue is the going concern of that fund in light of the Control of Budget Directive on funding of bursaries by the county government. And that is the issue that have not been addressed, and also non-disclosure in notes of some, in terms of transitional issues, and an issue on unresolved prior year matter. So on bursary fund, those are the three issues. That is the going concern due to that effect of the Control of Budget Directive, the issue of unresolved prior year matter, and also compliance with transitional issues. On Siaya County Climate Change Fund, there are several issues, and here majorly the county have not complied with financing locally led climate action registration, and in all there were there were 12 issues, and 11 were not addressed and 1 was partially addressed. Yes, and this one, it has a lot of, those of them 11 were consistent with the previous year issues that were listed. Thank you, Chair.
Very well. So we have the two funds before us. I think because of time, we will look at the bursary, and then the climate change, we are going to retreat and look at the written responses. If we need to get clarification from the county, we will contact the county to give us clarification. I'm even told that the administrator of this fund is not around. So we will only retire at the bursary fund, but this one, members, we are going to retreat very quickly to look at the written responses. So, Auditor, you can take us through the major query on bursary is query number 1, which is material uncertainty on sustainability of service. So you can proceed and read the query.
Thank you, Chair. Material uncertainty on sustainability of services. The statement of comparison of budget and actual amounts shows an amount of Kenya shillings 1.4 million on transfers from county government, being Kenya shillings 90 million under recurrent, Kenya shillings 44,000 under development, 44 million under development expenditure. Review of budget approval and disbursement documents revealed that the whole amount of Kenya shillings 134 million was approved, but the amount was not disbursed. No official communication, correspondence, or explanation was provided as to why the funds were not disbursed. In addition, it was noted there is no budget for any receipts and expenditures in the subsequent financial year 2025-2026. The non-disbursement of the amount of Kenya shillings 134 million caused a significant doubt in the Siaya County Bursary Fund's ability to continue to sustain its services, which was not disclosed in the financial statements.
Governor, your response?
If you allow me, Chair, I'll ask the CC in charge of education to respond.
Thank you, Chair. Management response, we note your findings and wish to clarify that Siaya County Bursary is dependent on disbursement from the County Revenue Fund with approval from the Office of the Controller of Budget. Every financial year from inception, Bursary Fund has been allocated funds and disbursements has always been done to the fund within the financial year. During the year under review, it was budgeted and requisitioned, but was not approved by the Office of the Controller of Budget because of legal issues as per the attached circular reference COB/CIR 002, Volume 2, dated 14th January 2025. The Office of the Controller of Budget indicates that for counties to legally undertake this national government function, there has to be a transfer of the function to the counties in accordance with Article 187 of the Constitution as read together with Intergovernmental Relations Act, Chapter 265F. The county did not budget for receipts and expenditures in the subsequent financial year because of the existing legal issues raised by the Office of the Controller of Budget. We have attached the circular dated 30th October 2025, reiterating that functions of the county government towards provision of education support stroke bursary. Thank you, Chair.
Auditor, your comments on the management response?
There's no evidence indicating the continued disbursement of the funds in the subsequent years.
Yes. Control of budget. Your comments?
Thank you, Chair. And just to say that this is a matter that has appeared before this committee many times. And of course, because of the circular that we issued and the matters before court, the counties that were interested to continue to issue bursaries were required to sign an agreement between the Intergovernmental Relations IGTRC, yes, together with the ministry. So they continue to issue bursaries as long as that agreement was in place. So I don't know for the case of Siaya if they didn't seem it fit to go into that agreement or what happened. So I would also want to know if they have an agreement already, and if the Controller of Budget still insists not to approve funds to them, then it's a matter I can follow up.
As we speak now, we have that agreement signed between us and the Minister of Education and the IGTRC. So there's a valid agreement of transfer of functions. So we should be able to operate the bursaries. But in the current financial year, because of this legal hurdle, the monies that were originally budgeted for the bursary fund, they were reallocated through a legal process where these amounts of money were used in other things in the budget.
So any question from members or observation or comment?
Chair, so basically it means because of that issue, the governor reallocated and we have done other things for the county. So, you know, but these are benefits that will really assist the poor. I don't know if he has intentions to budget for 2026-27 so that at least, you know, the poor from Siaya County, because I know there are poor people everywhere, so that they can benefit. You know, some of us went to school because of missionaries, but now that we have money at the counties, they should be able to assist the poor.
Yeah, we are going to budget this, even from the county assembly. I think they probably would comment on this. The non-operation of this account for bursaries was a matter they did not take very lightly. But having resolved the issue with now the control of budget, in the sense that we have now signed an agreement, we should be able to provide for those who are entitled to get these bursaries.
Thank you, Chair. Maybe Auditor, related to that query. In the other query, you queried about the unsupported allowances and some discrepancy in money given. And yet the governor is saying money was not put into this account. Then what was happening? Were there still meetings happening and still the the disbursement which you are querying that they were not supported, where was money coming from if the entire amount was never transferred to this fund?
You are making reference to prior year issues. Okay, maybe it's a prior year issue. That's for 2023, 2024.
Yeah, I get it.
So maybe on that, I just allow the auditor to make a comment on prior year issues.
On prior audit matters on some prior year matters have been resolved. However, we are still waiting for the status report on implementation of the oversight recommendation by the fund.
Okay, maybe at that point I can allow the assembly to make a comment, a general comment on the bursary.
The issue has been very thorny actually in our counties, but since now it has been resolved and been signed, we are happy for that, and we expect now to give more education to our people. Thank you.
Yes, I'm being asked by my clerk that we will comment on the issue of the tenure of the fund. The period is a period of 10 years is expiring. So, so what arrangements have you put in place?
I think that matter having been brought to our notice, I think the County Assembly is well placed together with us to look at this legislation which is here. And I can assure you that they will not hesitate to renew the fund in terms of the tenure which is spelled out in the County Assembly Act.
Honorable members, any further issues? I think that brings us to the end of bursary. As I communicated, the matter of the climate change will be handled internally. And in case we need further clarification, we'll do that. So we'll now go to the closing remarks. Any member with a closing remark? Senator Siemi.
Thank you. Chair, mine is just to thank the Governor for Siaya for coming for this committee meeting and remind him that because he is looking for second term, that you don't want to be re-elected, Governor. I meant yours.
You don't want to discuss it here.
Chair, mine was just to remind him that he continue to serve the people of Siaya because my second home is in Siaya. So please do the best for my people. Thank you.
Okay, any other closing remarks?
Chair, I don't have. I just wanted to tell the Governor we'll be visiting you soon as Energy Committee to come and see where the nuclear plan will be put.
Oh, you're welcome. It's very near where the fish is.
Governor, your final comments?
I want to thank the committee. I want to emphasize that on my part, I really value this process, oversight on account of the Senate and accountability that we all required to abide with in terms of the Constitution. So however difficult the questions are, however complex the questions are, I think we are duty bound to appear before this committee and other committees on the Senate. And when you sit on these functions, you sit under a delegated authority from the people of Kenya. So I want to thank you, and it's always a pleasure appearing before the committee.
Very well. Thank you, Governor, for honoring our invitation to come. I think we are very grateful. Having been a senator and a minority leader, we are very privileged to have you come back home and respond to the issues. I think we have seen from when we started, was 2022-2023 financial year. We started with water. There were a lot of issues in SIBO, and then we now came to hospitals and also funds. But there has been a noticeable improvement in addressing the issues that the auditor has raised, and to us, that is the spirit that we need to have between us and the governors. So we are very grateful, and we look forward to maybe after April to visiting Siaya to visit some of these entities. So thank you very much. I think, honorable members, the meeting is adjourned until Monday.